The nation's largest pediatric group is suing Health and Human Services Secretary Robert F. Kennedy Jr. The doctors are seeking to reverse decisions that reduce the number of shots in the childhood vaccine schedule. Medical reporter Lori Johnson brings us the story.
Until now, the CDC recommended more than 70 shots throughout childhood. That number has been reduced by about half, according to the new vaccine schedule that's already in effect.
The president asked us to look at what the European countries were doing, which have much less chronic disease than we do, and to find out what the best practices were there and to implement them.
The CDC still recommends all children be vaccinated against 11 diseases, such as polio, mumps, measles, rubella, tetanus, and chickenpox. But a half dozen diseases were dropped from the list, such as hepatitis A, hepatitis B, RSV, flu, some forms of meningitis, and rotavirus, which are now only recommended for children deemed high risk or through shared decision-making with a healthcare provider.
It doesn't take anybody's vaccine away from them. Every vaccine will be insured. Every vaccine will be part of the Vaccine for Children program. They will be paid for.
President Trump said the new schedule is rooted in the gold standard of science and widely agreed upon by scientists and experts all over the world, adding many Americans, especially the MAHA moms, have been praying for these common-sense reforms for many years. FDA Commissioner Dr. Marty Makary says these recommendations are designed to increase vaccine participation by identifying the most important ones.
We've seen vaccination rates in children go down in the Biden years because of the dogma of ignoring natural immunity and cloth masks on toddlers for 3 years and shutting kids out of school. A lot of dogma resulted in a loss of public health trust. We're trying to rebuild that trust, and we're giving parents a hierarchy of vaccines.
Tragically, our federal government can no longer be trusted in this role.
Dr. Sean O'Leary of the American Academy of Pediatrics, however, says the move has spawned the opposite reaction and advances Kennedy's campaign of vaccine misinformation.
Frankly, a lot of these falsehoods have been really, spread by our HHS secretary over the last couple of decades that we then deal with in the office. The problem is now they're coming from our federal government. And so it's an incredibly challenging time. Vaccines are a good thing.
Many doctors have expressed their plan to follow the old schedule.
This administration has decided that they think they know better than the independent science-based experts that made recommendations for vaccination of our children for over 50 years.
So while healthcare experts and parents seek what's best for children, exactly what that is continues to divide many Americans. Lori Johnson, CBN News.
Well, I encourage you to take control of your own life and particularly the lives of your children and research what is absolutely necessary for them. Some of these that are on the necessary list absolutely will protect not just your child, but the entire population. The rise of measles right now is very deeply concerning to me. But just, if chickenpox were eradicated, then when you age, you're not going to be subject to shingles. I mean, there's so many ramifications to this. But when you just look at the sheer number, it's got to be an overload for any immune system, any child, when you say, well, there's going to be 70 plus vaccinations. That should be a decision. Are you high risk? Your parents definitely need to be involved in that, and consultation with your doctor. But let's echo what the secretary said. He's not taking any vaccination away. If you want that, if your pediatrician is recommending it, then follow that medical advice. But to mandate it is no. That's not a culture. No, that's not where we.